Good morning, all. I am Dr. Subrat Kumar Palo, scientist at ICMR Regional Medical Research Center, Bhubaneswar, Odisha, India. This study is about role of healthcare seeking behavior on antimicrobial resistance, findings from an acute febrile illness survey. Why this study is important? Because as all of us know, infection caused by multi-drug resistant strain that leads to increased morbidity, increased mortality, difficult to treat, increased hospitalization, increased out-of-pocket expenditure, and its further transmission to others. Improper healthcare practices they are responsible for antimicrobial resistance. Such practices include self-medication, consultation with informal practitioners, use of over-control drugs, polypharmacy, and irrational prescription of antibiotics. Everybody wants strengthened power, and so is the case in case of bacteria. The novel bacteria wants this strength in form of resistance. There are multiple factors which is responsible for this resistance, out of which inappropriate use of antibiotics, incorrect diagnosis, hospital use, they are related to healthcare seeking behavior. Now it is up to in our hand whether we want to stop this novel bacteria from getting the resistance or we want to give a high five to those resistant strains. Regarding this study, this is a hospital-based longitudinal survey for acute febrile illness. This this AFI survey it was carried out in a health demographic environmental surveillance system cohort which was based in a rural area with a population size of more than 76,000. Among the study participants, 1,015 AFI cases they were enrolled from six healthcare facilities, two were community health centers, four were primary healthcare centers. Among all the study participants, blood samples were collected for blood culture, out of which 13.5% of the cultures they showed positive for bacterial growth and rest were negative. Among all positive samples, 78.1% they were found positive for staph aureus, which were further studied, and the rest were positive for E. coli, Enterococcus, Proteus, etc. The right side shows the distribution of positive and negative samples, and below table shows the socio-demographic indicators among the FI cases and culture positive cases. Those 107 staph aureus positive samples they were further studied for antibiotic susceptibility and bioavailability. Antibiotic susceptibility was done using a panel of 15 different antibiotics that showed none of the sample was sensitive to all the antibiotics, while 9.3% were resistant to at least two antibiotics, 50.4% they were resistant to 3 to 5 antibiotics, and 40.3% samples they were resistant to 6 to 9 antibiotics. In biofilm using microplate method, biofilm was strong in 27% cases, moderate in 46.7%, and weak in 26%. In healthcare seeking, 27.4% of the participants they visited directly to the PSC or CSC, while 42.5% they had consulted someone before coming to the PSC or CSC, and in 30% cases they had consulted to two different sets of people before coming to the PSC or CSC. Among all participants, 53% had already used antibiotic before coming to this hospital, while in consultations other than doctor, 28% of the consultations were to pharmacist, 35% to frontline worker, 13% to informal healthcare provider, and 24% self-medication. Key messages from the study include awareness on AMR that should be done among the public, healthcare provider, drug seller, and this can be done by developing and implementing socio-behavioral change communication strategies. Implementation of strict drug and prescription policy that needs to be done and its adherence needs to be ensured through regular supervision. Facility and communal level surveillance mechanism needs to be established on drug prescription, selling and AMR. Before I conclude, I must quote the famous quote by scientist and former President of India, APJ Abdul Kalam, that widespread use of antibiotic promotes the spread of antibiotic resistance. Smart use of antibiotic is the key to controlling its spread. Thank you.